is Madison. I'm going to be your nurse today. Before I begin, I'm going to go ahead and perform hand hygiene, pull the privacy curtain, and make sure that the bed breaks are locked. I'm also going to verify your name and date of birth while also checking your wristband. So can I go ahead and get your name and date of birth?
Paris Strauss, 6704.
Perfect. And just to clarify, do you have any allergies?
No.
And are you experiencing any pain at this time?
No.
Perfect. So I'm also going to let you know that we are doing a head-to-toe assessment on you today. Is that okay?
Yes.
Perfect. So before I begin, I'm going to inspect my patient's general appearance. This is their overall appearance, their skin color, which fits their ethnicity. I'm going to be looking at their hygiene, their nutritional status, and their grooming and mobility. All are normal and expected. I'm also going to go ahead and inspect and observe my patient's mental status. So this is their mood, behavior, and I'm going to ask my patient some questions. Is that okay? So what year is it?
2024.
And do you know what month we are in?
September.
And do you know where you are?
Hospital.
Perfect. My patient is alert and oriented ×4, no delayed or slurred speech. Next, I'm going to go ahead and get my patient's baseline vitals, which is blood pressure, respirations, O2, temperature, height and weight, gait, and I'm also going to get their pulse, rate, rhythm, and quality. So now I'm going to begin my head-to-toe assessment on you. So I'm going to go ahead and put on some gloves while I inspect and palpate your head and face. So with this, I'm inspecting my patient's face is symmetrical. I'm looking for symmetrical facial expressions. Can you go ahead and frown, smile, puff the cheeks, and raise your eyebrows? Patient's face is symmetrical. Next, I'm going to go ahead and I'm inspecting my patient's hair. Hair is clean, color is good, and I'm also looking at the distribution, making sure there's no indications of alopecia, and distribution is even. Next, I'm going to go ahead and palpate your scalp. So this, I'm going to look for any lumps or bumps and any abnormalities and infestations in your scalp and hair. All are clear and normal. Now I'm going to go ahead and inspect your eyes. So with this, I'm looking at your eyelids, eyelashes, looking at the overall appearance. I'm also looking to look at your conjunctiva. I'm going to have you remove your glasses for me. I'm looking at the conjunctiva, which is pink and moist, and I'm also looking at my patient's sclera, which is white, and her iris. I'm now going to do a pearl assessment on my patient. So I'm going to have you look at my nose and follow the light, okay? Perfect. So patient's pupils are reactive, clear, equal in size and shape, and are normal with pupillary response. Next, I'm going to go ahead and inspect your ears. So with this, I'm looking on bilateral sides. I'm looking to see if there's any redness, swelling, lesions, or growths. None that I can see on both sides. I'm next going to palpate your ears and your mastoid process, looking for any tenderness, swelling, or pain. Do you feel any pain?
No.
Perfect. Next, I'm going to look inside your inner ear canal and look for any cerumen buildup, blockages, foreign bodies, and same on the other side. All are clear and normal, and there's also no edema. Now I'm going to inspect your nose. So with your nose, I'm inspecting that the nose is symmetrical to the face and midline. I'm looking to see if there's any lesions or growths, which is none to the eye that I can see. Next, I'm going to palpate for any masses. I'm going to have you tilt your head back just a little bit. Septum is not deviated. I'm also going to look inside your nares. No redness, swelling, no discharge or blockages or foreign bodies. And I'm also going to have you hold one nostril and breathe. And same thing on the other side. Nares are clear and patent. Now I'm going to go ahead and examine your mouth and your oral cavity. So first, on appearance, I see that the lips are pink and moist. I'm going to have my patient open her mouth and look in her oral cavity. Tongue is intact, teeth are intact, oral mucosa is pink and moist, tonsils are present, and airway is open and patent. Now I'm going to go ahead and inspect your neck. So with your neck, I'm going to see if there's any masses, lesions, abnormalities that I can see. I see that the trachea is midline. And now I'm going to palpate for your lymph nodes in a circular motion. I'm going to palpate your carotid pulses on both sides, which are present and +2. I'm going to then have you hyperextend your neck and swallow, feeling for the thyroid gland and making sure that it is intact, and also verifying that the trachea is midline. I'm next going to have you perform range of motion on your neck. So I'm going to have you put your chin to your chest, and then you can go back up, and then chin to each shoulder. Perfect. Range of motion is normal and as expected. Now I'm going to go ahead and move on to your upper extremities. So with this, I'm looking at your skin color. I do not see any cyanosis or pallor. I'm looking at your skin texture. I'm seeing that your skin is warm and dry. I'm also seeing if I see any discolorations, abnormalities, deformities, any scratches, lesions, bruises, and any edema, which none are present. I'm also inspecting your fingernails and if there is any discoloration or clubbing, which there is not. Next, I'm going to go ahead and palpitate your arms, your shoulders all the way to your fingertips, feeling for any edema or abnormalities. I'm going to palpitate your brachial pulses on bilateral sides and your radial pulses. Perfect. I'm also going to do tap refill on your fingers, on bilateral hands. Tap refill is less than 2 to 3 seconds. Next, I'm going to also evaluate your skin sugar. So I'm going to take your skin under your clavicle and pull up. Perfect and normal. Patient is not dehydrated. Now I'm going to move on to your chest cavity. So I'm inspecting equal chest and rise fall. With breathing, I'm looking to see if I see any discoloration, lesions, abnormalities. I'm also looking to see if I see any scars. I would also be looking at the breast tissue, looking for any lumps or bumps, and also in the axillary regions to see if I see any rashes or lumps, which all are clear. Now I also see and look to see if I see any nipple discharge or discoloration. Next, I'm going to go and chest is symmetrical. I'm then going to palpitate the chest, starting with the sternum, down to the chest cavity, which is normal, no unexpected findings. And next I'm going to go ahead and also take your heart sounds and your lung sounds. So I'm going to go ahead and begin with your heart sounds, starting with your aortic. Listening to heart sounds for 1 minute each sound. Next is your pulmonic, your Erb's point, tricuspid, and mitral. I'm listening to see if S1 and 2 are present. I'm also seeing if I hear any murmurs or dysarthmias, which I do not. All are clear and equal. And I'm also listening for the rhythm and the depth as well. Next, I'm listening for your lung sounds. So I'm listening to 3 lobes on your right side and 2 lobes on your left side. Can you go ahead and breathe in for me? And go ahead and breathe in. And go ahead and breathe in. And on the opposite side, breathe in. And last one, go ahead and breathe in. Perfect. Lung sounds are equal and clear. Now I'm going to go ahead and inspect my patient's abdomen. I'm looking for the symmetry, the contour of the patient's abdomen, the skin color. I'm looking for any distension or discoloration or masses. I'm then going to go ahead and auscultate the bowel sounds, starting with the right lower quadrant, listening to each quadrant for 1 minute. Bowel sounds are normal and active. I would then percuss each quadrant of the abdomen. And next I'm going to palpitate the abdomen, starting with the right lower quadrant, asking my patient if she feels any discomfort or pain. And then I'm also feeling for tenderness or swelling while palpitating. All are normal and no abnormal findings. Next, I would go ahead and inspect my patient's genitalia area, which includes inspecting the genitalia, looking for any pressure ulcers or wounds. I'm also looking to see if a catheter is in place. If so, I would look at the tubing, make sure there's no kinks, and making sure that it was open and patent, and also looking at the output color. Next, I'm going to go ahead and inspect your lower extremities. So with this, I would be inspecting your skin color and texture, which is normal, warm, and dry. I would be inspecting to see if I see any discoloration, bruising, any edema, any lacerations, cuts, burns, scratches, which are all clear. And next, I will go ahead and palpitate from your thighs all the way down to your feet. While I'm doing this, I'll also palpitate for the femoral pulse. Going down, feeling for any edema or abnormalities. None are present, I'll be feeling for the popliteal pulses. Going down, making sure legs are symmetrical. Feeling for the posterior tibial pulses. Going down to the feet, feeling for pedal pulses, which are +2. And then I would check cap refill on each feet, or on each toenail, less than 2 to 3 seconds. And then I'd also determine my patient's range of motion for their feet. So I'll have them go ahead and press down with the gas pedal and then pull up towards their face. Range of motion is intact and strong. While I'm also doing range of motion, I'm also going to have my patient go ahead and grip my finger or my hands. Grip strength is good and normal. And I'm also going to have my patient shrug their shoulders up and down. Perfect. Range of motion is as expected. Next thing I'm going to go ahead and do is I'm going to go ahead and have my patient either sit up or roll onto their side, whatever is comfortable. So my patient is going to sit up. Perfect. So with this, I'm looking at their posterior view. I'm looking at their spinal curvature and alignment. I'm looking to see if I see any discoloration, lesions, abnormalities. I'm also looking for any cervical step-offs. And I'm also looking at their posture and to see if there any accessory muscles are in use. I'm also going to now auscultate your lung sounds on your posterior side in a zigzag motion, and I'll have you breathe in every time I place the stethoscope. Go ahead, breathe in. And last one. Perfect. Lung sounds are equal and clear. I will then help my patient go back into a comfortable position. I would place the blanket over her, make sure that the bed is in the lowest position. I would then go ahead and make sure that the call light and water is in reach. I would then go ahead and pull the privacy curtain back. I would ask my patient if she has any questions. Do you have any questions for me?
No.
Perfect. I would perform hand hygiene, and then I would document any normal and